announced that Toronto can now move to stage 3 of reopening this Friday. This is good news for our residents and for businesses, and only possible because of the commitments that Torontonians have made to keep each other safe. As part of stage 3, as of Friday, Toronto residents are allowed indoor gatherings of up to 50 people and outdoor gatherings of up to 100 people. A number of city facilities and amenities will also reopen in stage 3, including the city's more than 800 playgrounds and play structures, community and recreation centres, and libraries for all on-site services. I've been looking forward to this day since March. Closing these playgrounds months ago as the pandemic began was based, as all our decisions have been throughout this crisis, on the best public health advice that we had. But these were all tough decisions, this one with playgrounds and a number of others along the way. No mayor or no councillor, nobody wants to close playgrounds. We want to open them if we possibly can so that families can have fun in their communities. That's the whole point of a playground. So it's a relief to know that our public health officials believe that it is now safe to reopen these playgrounds when we move into stage 3, effective midnight on Friday. City staff have been preparing for these playground openings. They have been out inspecting and readying playgrounds and play structures and will be posting updated signs with public health advice. Playgrounds will reopen on Friday, though some of the signage at the playgrounds will be updated in the following days. Other activities able to resume in stage 3 with mandatory public health measures in place, including the tougher measures that Council approved this morning, include indoor dine-in service at restaurants, providing all patrons are seated at all times, eating or drinking, and are seated at all times. I know this is an important change for thousands of restaurants across our city who've been hanging on as best they can since they had to close indoor dining. I encourage all restaurants and bars to make sure they are following all of the public health regulations and guidelines. And for example, one of the changes made by the City Council was to take a requirement of sitting down while eating and drinking and extend it to all times except when you are going to the washroom or coming back, coming in and out of the restaurant and paying, otherwise seated at all times to prevent the kind of coming together that people could have that could spread the virus. We've made excellent progress on stopping the spread of this virus, COVID-19, and we most certainly do not want to go backwards. So please, open your doors carefully as you open. I'm saying this to businesses and to people as we reopen the city and have the larger gatherings that are allowed and so forth. Let's do it carefully for the sake of people, for the sake of customers, and for the sake of employees. If we do this in the right way, we're hopeful to be able to continue on the restart and move to more and more openings of the city and more activities, and we won't face the setback of a large second wave that requires a return to lockdowns. The businesses and services able to reopen in stage 3 are crucial to helping our economy recover, provided they follow the rules. I cannot stress enough that all reopenings must take place within the public health measures that are in place and complying with provincial orders and city bylaws, including physical distancing and mandatory masks or face coverings inside. And all of this is set out in detailed guidelines that we've put together for the benefit of all those who have these businesses, or for that matter for people or for their customers. We are moving into stage 3 because we have made progress stopping the spread of COVID-19, and that is thanks to the sacrifices already made by many of the businesses that are now reopening. While the number of new cases has fallen dramatically to the single digits, I cannot stress enough, as you will hear Dr. de Villa do as well, that COVID-19 is still here. COVID-19 does not take a summer vacation. This is clear in some areas that have moved to stage 3 or to stage 3 type circumstances and are seeing rising case numbers. It is clear in other places where there is division, where there is a lack of cooperation or a lack of personal responsibility or a lack of compliance, or sometimes all of those put together, we see what happens. We must not go there. We just have to keep doing the right thing as we've been doing, uncomfortable, sometimes inconvenient, or sometimes as complicated as that may be. Keep wearing a mask or face covering as often as you possibly can. In anticipation of stage 3, the mask bylaw does have provisions for eating and drinking indoors and receiving facial services and things like that. And now, after the actions of City Council this morning, in the common areas of apartment buildings and condominiums, people are asked, in fact required, to wear a mask. This is just out of consideration for the people that you are coming and going and seeing in all of these places, including now common areas of apartments and condo buildings. Your mask protects others, and their mask protects you. To help people stay safe, a number of city programs put in place during the pandemic will continue into Stage 3. And that includes expanded patios implemented through the Cafe TO program. They will continue to operate. Active TO, major weekend road closures and quiet streets, will continue to offer people just that little bit of extra space to enjoy the outdoors. The 40 kilometers of additional bike lanes are in the process of being installed. We're well along with that. Parks Play TO is up and running, offering free drop-in and activity-based recreation programs to children at multiple places across the city. Summer in the Six continues for youth 13 and up to give them opportunities to participate in themed activities and things that are very helpful. I trust the doctor's advice, our doctor and the other doctors involved, that we are ready to move into Stage 3 on Friday. And I thank the province, including Premier Ford, for listening to our health officials and moving our city and our region forward when they thought it was right to do so, when we thought it was right to do so as well. I thank them for also the constructive, receptive way in which they have considered the differing needs of our city, including some of the measures that will affect bars and restaurants as they reopen. I'm very proud of the work that city staff are continuing to do as we continue to respond to the pandemic and make sure all of our residents, especially the most vulnerable ones, have the services and supports that they need. This work, along with the cooperation and support of every resident, has helped us to continue to get through this pandemic. And while we still have a long way to go, we are moving towards a better place, finding a way to return more and more to the lives that we knew before this crisis began. The hard work, though, really begins now. It's the same way with any achievement. It's one thing to get to a better place. It's another thing to stay there. If anything, more discipline, more consideration for public health, more compliance than ever with guidelines and rules and recommendations are needed if we're going to keep people healthy and if we're going to keep moving forward together. Finally, for today, I'm pleased to provide a positive update on a very important city service that impacts many families across the city. Over the past few weeks, as we have started to reopen city services and amenities, I've been hearing from many parents that are eager and anxious so as to get their children back into childcare so that they can get back to work, and they're just anxious to know what's going on. These past few months have taught us the importance of good access to good childcare. I'm happy to announce that the city is reopening an additional 10 of its directly operated childcare centres over the coming days. 2 were reopened last week, while the rest will open by next Tuesday. The phased-in approach follows provincial regulations and mirrors the cautious approach that we are taking with the reopening of all of our city services and amenities so as to keep people safe and healthy. We know we need to do this right, and we need to focus on the health and safety of our residents, especially our children. We must also balance this important priority with getting our city's economy back on its feet. You can't fully and effectively reopen the economy without reopening childcare. City staff have conducted an assessment of current Toronto early learning and childcare service centres to determine which sites can be reopened with the new guidelines in place. There is much more to say and do in this entire area of children, childcare, and education, and we will continue to work on those issues on our own and with the other governments, because these things, including the return to school, are vitally important to all the people of the City of Toronto. I want to thank staff for bringing us to this point and for allowing us to be able to open these centres quickly and safely. This news will be most welcomed by families who are eager to have these centres open once again. It's now time for Dr. de Villa to provide her report for today.
Thank you, Mr. Mayor, and good afternoon. Today, there are 13 confirmed and 6 probable new COVID-19 infections in Toronto. To date, 13,785 people have recovered, an increase of 39 since yesterday. I'm pleased to see our numbers trending in the right direction. Today is a significant day for us. As Premier Ford announced earlier today, we will join many communities around the province in Stage 3 of reopening at 12:01 a.m. on Friday. We are making good progress in reducing the spread of COVID-19 in our city. And as I've shared many times before, this is the result of your continued hard work. Together, we've been protecting our friends, our families, and our loved ones, and we have made sure that our healthcare system is available for those who need it. Taken all together, what this means is that we will get a bit more of our city back this Friday. However, as I've stated before, COVID-19 is still here. We need to stay focused to prevent new cases or a spike in activity as much as we can. For this reason, I ask that you keep following our public health measures as you begin enjoying the activities we have all missed and that we are all looking forward to. We need to proceed with caution and with care as we move forward. Whether it is dining indoors, at a local restaurant, attending a concert, going to the movies, or visiting a library, please keep washing your hands, watching your distance, and wearing your mask. These measures are still needed to keep us as safe as possible as we move forward. In Stage 3, as you've heard, indoor gatherings will be permitted for 50 people and up to 100 people in outdoor settings. And of course, mandatory masks are required in all indoor public settings, with some exceptions, such as when you're eating, drinking, or exercising. Wearing masks will be part of our new normal for the foreseeable future in order to help keep each other safe as we move forward. As Canada's largest city, we need to consider what is necessary for our city and our local circumstances to move forward into Stage 3 and to keep our residents and our city as safe as possible. Recent increases in COVID-19 cases reported in other cities that have reopened before us provide clear evidence of the potential for this virus to spread, if given the chance. We need to move forward with caution and care so we don't lose our progress. To help us move forward as safely as possible, on today's City Council agenda was a report recommending additional public health measures to reduce the spread of COVID-19. These measures were recommended as part of the provincial Stage 3 order applied to our city, recognizing that Stage 3 comes with opportunity for more close contact between people, especially in indoor settings, and therefore opportunities for COVID-19 to spread. In food and drink establishments, I recommended in this report the screening of staff for COVID-19 symptoms at the start of every shift, requiring capacity limits of no more than 100 people indoors and 10 people per table, requiring customers to be seated at all times unless entering or leaving, using the washroom or paying, keeping a customer log with contact information for at least one member of each party, along with the date and time. And it's expected that information should be held for 30 days and provided to my team at Toronto Public Health if needed for contact tracing. For condominiums and apartment buildings, given the number of people in those settings, we asked for a temporary bylaw for buildings to have policies requiring the use of masks or face coverings in enclosed common spaces, such as lobbies, elevators, and laundry rooms. We also asked for signage to be displayed. Similar to the existing bylaw on mask use in indoor public spaces, there are exemptions. For example, for people who are unable to wear a mask or face covering for medical reasons, for children under 2 years of age, and other reasonable accommodations. I'm pleased to report that all of these recommendations were just approved a little earlier today by Council. We will continue living with COVID-19 until an effective treatment or vaccine is available. Until then, there continues to be an ongoing risk of infection from this virus. For this reason, once again, I ask that you please continue to wash your hands, watch your distance from others, wear your mask, and please continue to take care of each other. I'll now hand it over to you, Don.
Thank you, Dr. de Villa and Mayor Tory. We will now take questions. As a reminder, it is one question, one follow-up. Before we get to your questions, we have staff on the line who can answer your questions as well, including Carlton Grant, Executive Director of Municipal Licensing and Standards, Marianne Bedard, General Manager, Shelter Support and Housing, Janie Romoff, General Manager, Parks, Forestry and Recreation, Paul Raftis, General Manager, Long-Term Care, Support and Services, Shanley McNamee from Children's Services, and first up, to ask a question, we have Austin Delaney from CTV.
Dr. de Villa, thanks for taking my question. What do you expect to happen with the numbers when we go into stage 3 in the coming weeks? And if they start to rise significantly, at what level is it that you call it back?
So thanks, Austin. Excellent questions. I do think we should expect, as we have seen in other jurisdictions, that as there is increased reopening and reestablishment of services and activities that have been relatively quiet or non-existent for some period of time, we will see more interaction amongst and between people, and therefore there is the risk of more COVID-19. That should not be a surprise. We are, of course, expecting or anticipating that there may be increased activity in a wave 2 type scenario, and what that looks like, nobody can really predict in advance. However, much can be done. Much has been done already, and much can continue to be done in respect of preventing that type of increase from happening, or at least minimizing it as much as possible. And that actually rests with all of us continuing to follow what we know works. Physical distancing is the mainstay of prevention. Keeping our distance, not staying in close contact with others, save and exclude for those that are in our social bubble, is the mainstay. Of course, there's still washing your hands, wearing a mask when you can't keep that distance, but these are all the important elements that must continue. It's what has gotten us this far, and I think we need to stay the course with those public health measures to keep up the progress that we have thus far. There isn't necessarily, though, a magic number at which we need to dial things back. I think really what we're trying to do is limit the spread as much as possible, ensure that we're able to maintain the key public health functions of case management and contact follow-up. And when we look at the advice that's out there from all the experts and look at the experiences of others who are a little bit ahead of us and have had some opportunity to reopen their services and activities in cities ahead of us, we know that this is exactly what we need to do. Keep up with public health measures and stay the course.
Thank you, Doctor. As a follow-up to Mayor Tory, do you anticipate enhanced enforcement at restaurants, bars, etc.?
Well, I think that when you take into account the fact we have 7,000 premises where people eat and drink across the city, that obviously the challenge of trying to enforce in every corner, every hour of every day is not possible. So you have to count on, as you do with most laws, people to follow the laws, to comply with the laws. And I think that businesses having been through the punishment they've been through, employees having been through the punishment they've been through because of this pandemic, and frankly, the people who haven't been able to go to their favorite eating spots or watering holes, I think you're going to get widespread compliance with this, and we will try our very best to enforce the law. I don't direct that enforcement, but I know our people will want to be out there making sure people go along for the benefit of the entire city and for the benefit of keeping us healthy.
Next up, we have Mark McAllister from City TV.
Hi there. Just wanted some clarification based on the discussion this morning with the provincial release, what the Premier has just said, and what has been passed at City Council. There are a number of recommendations that were initially made to the province and requests for what could be done. Some of those were passed by Council not too long ago. Some remain in limbo as far as I can tell. Can you better spell out what is happening beyond what was passed at Council and what will be happening and what you're waiting for the province to do?
Well, I can give you an example of one that was not passed by council because we were advised by our solicitors we don't have any jurisdiction to do so. And that is one that would alter the hours of bars, for example, and have an earlier closing time. That is not within our jurisdiction to do. We were so advised by our solicitors. That was put into the hands of the province. If I was guessing, I would say that one might be a doubtful starter. They've indicated a number of the other ones that we passed already, but that they will likely now include in the revised Stage 3 order could include, for example, the clarification, if I can call it that, that says you should remain seated at all times, basically when you're in a restaurant or bar, not just when you're actually eating or drinking. And that was meant to make it clear that aside from when you're coming and going, people should be seated at all times to avoid contact with each other. So we can't really tell you exactly which ones the province will put into place until they actually pass them, which may not happen for a day or so, but we're pretty confident that several of the measures, like the one I mentioned, will be passed by them. They've also been passed by us, so we're well protected in terms of these enhanced measures to protect public health.
Any follow-up?
That's it. Thank you.
Next up, we have Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Oh, hi. Thanks very much. Question, I guess, for Dr. de Villa, but Mayor Tory, feel free to jump in if you like. I just wanted to ask about, is it conceivable? I mean, everyone talks about expecting numbers to go up, but given the number of restrictions and extra precautions that are being put in place, you know, I talked to a number of epidemiologists who say the goal still has to remain to keep these numbers down, going down, and they're so low just in the last few days. Is it possible, is it reasonable to be hopeful that we could actually see these kinds of low numbers continue?
So I think that's an interesting question, Jeff, and I think the simple answer to that is that, of course, we hope for the best, but we have to prepare for worse than that, and hopefully not the worst, but certainly we do prepare for, you know, the worst case scenarios so that we are ready for that. But of course, we are hoping for the best, and we recognize that our ability to contain and control the spread of this virus does really rest in our hands. The more each and every one of us is able to continue practicing good public health measures, you know, watching your distance, wearing your mask, washing your hands, all that advice we've been offering for the last several weeks, the more we're able to actually practice that, the more likely we are to be able to contain the spread of the virus until such time as we have effective treatments or a vaccine. Any
follow-up, Jeff?
And, oh, yeah, just to follow up, and maybe the mayor could chime in on this, just given that the messaging on Stage 3 is so delicate, we need to keep our guard up, but we're letting our guard down. It seems like we had this house party in Brampton. We've had some issues with parties in Ottawa causing spikes, and I don't want to talk about the United States. Is there going to be a push to really drive home the message that, yes, we're allowing larger gatherings, yes, you can go to a bar with these rules, but you know, COVID-19 is still here? Is there going to be like an advertising push or something to remind people who aren't watching this press conference that they need to still remain cautious?
Well, with regard to advertising campaigns, we just don't have the muscle at the city, the financial muscle to mount the kinds of campaigns that the province does, but they've had a very extensive and helpful educational campaign in earlier stages, and I'm sure they will now, because that message is the important one. You know, COVID-19 is not over. And in fact, the kinds of irresponsible backyard parties that don't happen, the ones that we've seen are ones with valet parking and just bizarre preparations that went into them. So they were deliberately, you know, intended to occur. And these are the kinds of things we can't have. We have to have common sense, and we can't regulate or legislate or advertise common sense. We have to have common sense when it comes to showing up, finding a beach is crowded, and frankly turning around and saying you're going to go somewhere else. And it's the same with all crowd scenes and how we comply in restaurants and bars and so on. Most of this is going to have to rely on personal responsibility. I think people are up to that because they've shown that already. We will be doing our part to try and educate and where necessary to enforce, but really a lot of it is going to be about education and about common sense, and I think people are ready for that. They don't want to go backwards.
Okay, next up we have John Chidley-Hill from Canadian Press. Go ahead, John.
Mayor Tory, this question's for you. Why were the additional measures approved by City Council earlier today necessary in your mind?
Because I think you're better to be really safe than sorry. That's the approach we've taken throughout. I mean, why did we ask way back when for a regional approach to be taken to take into account some of the special considerations that Toronto has in terms of our population density, some of the spread we'd seen in some parts of the city? We felt that that allowed the province to allow those places that had no spread and no cases to proceed to reopen. It frankly allowed us to get a bit educated about some of the challenges they faced when they did so. But I think these measures were, based on the expert advice of our medical officer of health and her team, what would enhance the chances of there not being a spread inside those restaurants and bars when they open, but at the same time to let them open because they're really struggling to stay alive. So I think they were necessary because we just felt in this city with 7,000 of those kinds of places where people can eat and drink that the safer you can be, the better everybody will be, and the less chance of there being a spread at least caused by things that go on in those places.
Thank you. I do have a follow-up for Dr. de Villa. In your mind, what is your biggest concern as Toronto heads to stage 3?
Well, that's an excellent question, and it's probably been the biggest concern all the way through. I mean, really, what we've been trying to do is mitigate the impact of COVID-19, and my concern all the way through has been, how do we minimize the negative impact of COVID-19 on our city, both direct and indirect? We know that there have been that there are risks associated with infection. We know that there have been deaths all around the world. There have been deaths right here, and hospitalizations and severe illness associated with this virus. But we also know that this virus has required the implementation of public health measures, that they have themselves had some negative impacts. We've been talking about impacts on businesses, impacts on our children, impacts on mental health, and the inability for people to actually come together physically and to congregate together. And this has certainly negative health impacts, particularly on mental health. So it's always been about trying to balance the approach so that we optimize health, whether we're talking about health related to the disease directly or health from a social, economic, and other health perspective, beyond COVID-19. So my concern is to continue to try to optimize the health across the city, including for all groups, regardless of what their background is, where they're located in the city, and where they started off in terms of health pre-COVID. What we're trying to do is optimize the health of Toronto and to reduce any inequities in health in the city. Always been the concern and will continue to be our primary concern.
Okay, and next up we have David Ryder from the Toronto Star.
Hi there. Mayor Tory, can you elaborate a little bit on CP24 this morning? You made a statement that said if there are going to be big frat-type parties that you wouldn't hesitate to call Premier forward and say, maybe we have to go back to stage 2. Is that actually a real possibility, or is that kind of a threat to get people to not gather in an irresponsible way?
It's a bit of both, but you're now exposing that, David, which is not in the best interest. I mean, look, let's be candid here. We need people to comply. There aren't going to be enough rules, enough police officers, enough bylaw officers to be out there looking over every fence, nor should they be doing so. It's not the way we live here. But we need people to cooperate. We need people not to have these large gatherings that are outside of the rules. We need people to be sensible when they go on the beaches and other places like that. And I will say this, though, I will be guided again, as I have been throughout, without exception, the advice of our medical officer of health. But if she comes to me and says, and you'll see the numbers, they're all transparently disclosed, if the numbers and the situation in the hospitals and so on is such that all of those kinds of activities are contributing to something that threatens our return to a normal life and takes us the other way, I would have no hesitation in communicating with the Premier and saying that in my view, and in the view of our professionals in Toronto, that we have to go back or enhance some measure that we have in place to try and stop the activity that is causing a threat to public health. No hesitation at all.
Thank you. A follow-up, I think, is for Dr. de Villa, which is about playgrounds. Tory mentioned that a lot of parents are going to be rejoicing at the fact that they can take their kids to the park and not have to shoo them away from equipment with tape on it. Can you just reiterate for Torontonians how you're advising people allow that while having their kids and themselves stay safe?
So I will probably be joining those families in rejoicing around playgrounds. I think, especially at this time of year, this is exactly what we want to be able to enjoy, our outdoors and our playgrounds with this lovely weather that we're having right now. So I think there'll be many of us rejoicing. How do we maximize safety? How do we optimize safety for all of us as we seek to use our outdoor spaces, including our playgrounds? It all comes back to the basic public health measures we've been promoting from the very, very beginning. Physical distancing is first and foremost one of the mainstays of prevention of COVID-19 spread. So to the extent that some distance can be maintained, and I recognize it's a little less important, it's not as much of a concern outdoors, but that doesn't mean that there's no risk. The risk of acquiring or the risk of transmitting COVID-19 from one person to the next is definitely lower outdoors. It's not zero, though. So maintaining physical distancing continues to be important. And of course, good hand hygiene is another important component when it comes to playing outdoors. And not always easy, I appreciate that, but bringing wipes, bringing the hand sanitizer with you and trying to wash hands as much as possible. When you can get to a sink and use soap and water as soon as possible thereafter, I would encourage that. Trying not to touch your face too much with your hands, especially when they're unwashed. And of course, staying home and avoiding the playground and avoiding others, in fact, when you're feeling unwell or have any signs of illness. These are the core measures that we would ask people to undertake to protect themselves and to protect others around them.
Okay. Well, that's it for today. Thank you, everyone, and please have a great week.